102 of today's cases are linked to known outbreaks and cases, and the rest are under active investigation. We now have some 3,507 active cases in the state, all except 4 are locally acquired. This continues to be a pandemic of the young and the unvaccinated, with 87% of all active cases now under the age of 50. Today, like our general practice and primary healthcare partners, we are, of course, pleased to expand the vaccine eligibility to anyone aged 12 years and over. And with 585 of the current active cases aged 19 or younger, the importance of vaccinating teenagers is clearly very strong. Our group booking system through the state clinics is now up and running. They're very, very popular, as I understand it, from the early reports, and indeed the same advised applies from today in general practice. In regards to our active cases, we have some 529 of the active cases under the age of 9 years. I've dealt with the teenagers. We have people in their 20s, some 840, and people in their 30s, some 627. We processed 49,037 COVID-19 tests yesterday, and we delivered some 30,032 vaccines through the state-run clinics, the highest number we've delivered in our state-run clinics on a Sunday. We're now sitting at 66.9% of people over the age of 16 in Victoria who have had their first dose of vaccine, and that is fantastic. And we've just passed 41% being fully vaccinated. We have some 62,500 doses to go to reach our 1 million target for the current 5-week period. And at this rate, I'm confident that we will achieve that. We have 157 people currently in Victorian hospitals with COVID. 38 of those are in intensive care and 26 of those are on a ventilator. Sadly, 89% of those people, of the 157, were unvaccinated. 11% had received one vaccination, and none of those 157 were fully vaccinated. So the message is pretty clear. Vaccinations keep you out of hospital. Vaccinations get us to the other side of this outbreak, and vaccinations are our ticket to something that looks like a COVID normal life, and that's what we all need to aspire to. On the issue of vaccinations and other matters, particularly as they pertain to the construction industry, I'll ask Mr Pallas to say a few things, then Jerome, and then we're happy to take questions.
Thanks, Minister. And I suppose we are all, as we go through this pandemic, recognising that the challenges and the sacrifices that people have made in order to maintain social distancing and to ensure that they do the right thing, not only by themselves, their fellow workers, but also the community at large, does become an ever-increasing and challenging requirement. But of course, we are at a critical juncture. Construction remains one of the few industries which is still operating. And as you know, we're seeing increasing case numbers coming out of that industry linked to this workforce. What's become clear to us is that the construction industry remains a major source of transmission. The construction industry is young, it's mobile as a workforce. They often visit multiple sites in any given week, and they return home to all areas of metropolitan Melbourne, particularly, I might say, in the north and the western suburbs of Melbourne. Now, that represents a higher risk of spread of the virus. What's particularly concerning is the geographic spread of construction cases. What we're seeing is that the average construction worker, the outbreak case, lives basically about 20 kilometres away from the original outbreak site, compared to what we're seeing is about 4 kilometres on average for outbreaks connected, say, for example, to supermarkets. So with distance comes opportunity for the virus to spread. And the one thing that assists us in being able to deal with this issue is people taking their responsibilities in terms of how they mask and meet the broader requirements of social distancing. So I want to be clear, the majority of the construction industry is doing the right thing. But we all know, and we've all talked to people who've expressed concerns about examples that they've come across in this industry where the right thing is not being done. The nature of this workforce means that we have to go above and beyond the requirements for normal COVID compliance. So this is not about special provision and exceptions for the construction industry. It's about recognising that they have an obligation to go that little bit further, given the opportunities that they have as permitted workers to continue to apply their trade. As a result, of course, of the increasing risk in construction sites, and in order really to protect construction workers and their families, their communities, action needs to be taken to ensure that that risk is reduced. That's why today we're announcing 2 new initiatives: a priority vaccination access for construction workers and an enforcement blitz. So to support the construction industry, we'll release 20,000 priority Pfizer appointments over the next week and unlimited access to AstraZeneca to all construction workers. Might I say, AstraZeneca is the vaccination that I have, and can I tell you, I have never regretted the opportunity to get vaccinated by it. Bookings will be able to be made and appointments will be available from today. We'll be stepping up compliance and making sure that the industry, in all its different manifestations, recognises their obligations with regard to the Chief Health Officer's orders. So we'll have, starting with authorised officers and work safe inspectors from today, with the Victorian Building Authority likely to come online within the next week or so. We'll have something like 50 teams out and about each and every day, making sure that construction sites are doing the right thing, and by themselves, by their employer, by their families and by their communities. Given that the health risks the joint operation will have, and I need to be clear about this, a zero tolerance. The time for warnings and admonishment is over. This industry needs to take these responsibilities seriously. They need to recognise that the rights and opportunities that they get as permitted workers come with considerable obligations to the community. So that zero tolerance approach will apply to infringement penalties and prohibition notices to remedy any serious non-compliance. We've heard from the industry, and I've met with all industry players as recently as last night to take them through the nature of the problem that the community is confronting. And we've been pretty clear with them that this industry is in a very, very precarious position if the spread of the virus continues as it is, if the manifestation of the virus as it is being played out continues to emanate as a vector of transmission of the virus through these workplaces into their homes and their communities. So we've heard from the industry itself who've told us they want more enforcement and they want us to address those that aren't doing the right thing. So I do want to acknowledge industry associations and unions, major industry players who've made the point. They have themselves a zero tolerance for non-compliance with the requirements, and importantly, we need to see that replicated in every industry player. Everybody who constitutes the population of this industry needs to take these obligations seriously. So we also recognise that the government has a part to play as well. And that's what our priority access and the Blitz are all about. You've asked us for this, of course, as an industry, and we've listened and we're taking action. We will provide priority access to vaccination, and we will provide not only Pfizer, but we'll provide unlimited access to AstraZeneca. As we've done all along, we can tell from both the vaccine access and the enforcement blitz that there is a genuine commitment from this industry to assist in dealing with the broader community's problems. They've been talking to us about these problems for quite some time. They've been increasingly frustrated by what is manifestly inappropriate behaviour in certain sections of the industry, and they want to be part of the solution to make sure that these behaviours are effectively eradicated. So we'll do everything we can to ensure that the construction industry can continue in a COVID-safe way. But I have to say this, and I have to say this to every industry player, and I need to be very clear about it. The entire industry, employers, unions, are on notice. We've had significant transmission on building sites, and we simply can't afford not to act if that continues to grow. So the message here is this is a very serious state of affairs. The industry are taking it seriously. The industry players are taking it seriously. Now, everybody in the industry, every person employed in the industry has to take it seriously. Otherwise, the permitted worker status of this industry could well be at risk. So ultimately, we're asking the industry to do their part, as every Victorian is doing the right thing day after day. I'll pass over to Jerome.
Thank you, Treasurer. Good morning. 473 cases in yesterday's figures. That makes now 3,507 active cases of coronavirus in the state. 3,503 of those are locally acquired. We have 157 Victorians currently in hospital with COVID. 38 of those are in intensive care, and 26 of those are on a ventilator. And of course, we send our very best wishes to everybody who's recovering from COVID in our state at this point in time. Like recent days, like in fact the last 2 weeks, 91% of the last 24 hours cases are all in our northern and western suburbs. We have 338 cases in our northern suburbs, in key suburbs such as Craigieburn, Roxburgh Park, Meadow Heights, Broadmeadows and Glenroy. In our western suburbs, we have 97 cases in suburbs such as Truganina, Altona North and Tarneet. And in our southeastern suburbs, we have 23 cases in Casey, Cardinia, Dandenong, Berwick and Clayton. And there are 9 cases in our eastern suburbs, including Doncaster East and Ferntree Gully. Of the 6 cases in regional areas, 3 are from Mildura and are all primary close contacts of the existing case we discussed a few days ago, and 3 are in Geelong, again all known primary close contacts of 2 existing cases. Again, no new exposure sites to report on any of those, which is encouraging. That makes our total of 473 cases in the last 24 hours. Of the particular exposure sites of interest and concern, we continue to obviously focus on the Box Hill construction site. now 120 active cases in total. That's now starting its day 13 testing today. Obviously, we're very keen to try and get to the end of that particular cluster. In addition, recently we've discussed the Fitzroy Community School. There are now 31 positive cases associated with the school. There are 189 primary close contacts, and we'll of course be continuing to support the school community to test and to isolate over the days ahead. We have one further case at V-Line. That now takes us to five positive staff cases in total with V-Line. The latest case acquired the infection, we believe, in their tea room. A lot of work happening over the last 2 or 3 days with V-Line as we work to identify which of their drivers and staff are associated as Tier 1 exposures and which ones are Tier 2. My thanks to the whole V-Line team for working through those details, and of course still challenging times ahead as we work through the details of that. We have one positive case at a Ballarat residential disability site. This is somebody who resides in Metro Melbourne but works at the Ballarat facility. They were infectious on the 9th and 10th of September when they worked an overnight shift. There are 10 primary close contacts, but I'm pleased to confirm that of the 4 residents there, 3 have been vaccinated, and we'll obviously hope to get those test results over the course of today. And finally, at the Ascot Vale public housing site, we have no new cases today, 6 cases in total across 4 different households, and a number of those households have moved into alternative accommodation. Testing, of course, continues to be a really strong and critical part of our armoury as we work to identify how far the virus has spread into our wider community. Just over 49,000 tests yesterday, really strong demand in the north and west, and again we see strong demand in the north and west this morning. And please, again, I'd urge all Victorians, if you have any symptoms, no matter how remote, please come forward to get tested quickly. We have over 200 testing sites. We have many testing sites running extended hours. We have live waiting times on our website and active redirections in place. So if you need to get tested, you'll be able to get tested quickly and safely and have your results by the next day. We, of course, continue to do our day 13 testing protocols for primary close contacts, and another 1,359 primary close contacts were released over the weekend. And again, my thanks to them, and my thanks again to the many thousands of people who are currently isolating, either as cases or primary close contacts, for doing those hard yards. And by isolating, you're keeping the rest of us safe and giving us all the best possible chance of avoiding ongoing community transmission across our city and state. As the Minister said, it's been a very busy time in our vaccination system. 66,500 vaccinations over the weekend, our busiest ever weekend. That's almost 10,000 vaccinations more than previous weekend. So my thanks to everybody who's come forward to get vaccinated in the last few days, and of course the very busy now staff at all of our vaccination clinics across the state. We also saw 62,000 bookings made yesterday for future vaccine appointments. And again, please, I'd urge everybody, not just construction workers, but everybody to please come forward and get your vaccination done. With 2/3 of all Victorians now having had their first dose, it really is time for us to get on with the remainder of our community and to also start moving through our second doses. Even just in the next 7 days, we have 2,200 free Pfizer appointments available and 12,000 free AstraZeneca appointments available, and more appointments are coming on stream every day. As we receive more vaccine, we of course put it straight into our clinic so people can get it into their arms. In terms of first dose allocation or rollout across the state, for Victorians over the age of 50, 80% of them have now had their first dose, and it's great to see older Victorians now at least having got to that milestone. For those in their 40s, 3/4 have had their first dose of vaccination. For those in their 30s, now over half, 55% have had their first dose. And for those Victorians aged between 18 and 30, 44% have had their first dose. And finally, and really encouragingly, amongst 16 and 17-year-olds, over 1/3, 34% have now had their first dose. Again, it shows that we're making really good progress over the last few weeks, and of course we expect to have a really knockout vaccination drive over the coming weeks ahead. In our state clinics last week, we did 251,000 doses of vaccine. We're aiming to do 280,000 doses this week and to push for even further ahead over the weeks ahead. Finally, can I just thank, in particular, the essential workers who keep us all going during these complex lockdown times. The people working in our supermarkets, the people working, of course, in construction, and the people working in our health services and hospitals to keep all those critical services going whilst the rest of us are working from home and doing our best to isolate. It is so important that those essential workers also follow all those protocols. So please, in particular, we'd ask you to obviously be really careful at work and make sure that you understand your local employer's COVID safe plan. You're doing everything you possibly can to protect yourself. With 3,500 active cases of COVID in our community, and with cases across Melbourne, it's so important that you're so careful about who you might be coming into contact with at work. I particularly call out tea rooms. We've seen a number of cases in recent times, including the V-line cases, including some of our construction sites, where transmission appears to be happening in tea rooms. It's where we probably drop our guard the most. It's where we physically drop our masks to eat and to drink. It's also where we see people from different shifts and different workplace bubbles still interacting with each other. Please, tea rooms are not safe places. In fact, for many of us at work, they're probably now the most dangerous place. So please be very mindful of everything you do in that environment and minimise your time in that kind of setting. Secondly, for those authorised workers moving into regional settings, you're able to do so by the nature of your work, but please be very careful for whom you contact. As we've seen with the case of our Ballarat worker, it is so, the potential for you to be taking the infection from Melbourne into regional Victoria is significant, it's very real, and it'll be down to the strength of the workplace procedures and how you conduct yourself in regional Victoria as to whether you pass it on to other people. So we please ask all authorised workers who are going legitimately into regional Vic to be very, very careful. And finally, please come forward and get vaccinated. As the Treasurer has said, we have now made a number of additional vaccination options available, particularly to construction workers, additional hotlines to book dedicated vaccines, as well as additional walk-up facilities, all with a focus of getting you as safe as we possibly can at these critical times. With that, I'll hand back to the Minister for questions.
Ryan, before you leave, do you have a breakdown of the number of the ages of the people in hospital, given 80% over 50 have had their first dose?
I don't, Mark. I can put it up in the Cho release this afternoon and we can talk about it another time.
Do you also know our R number at the moment by any chance?
No, I don't have that, but I'm sure the Cho can update that later on.
Jerome, of the 31 people that have tested positive a part of the North Fitzroy school, do you know how many of those are children?
No, I don't have the breakdown down. I know all 31 are directly associated with the school community. Obviously, we'll expect to see, particularly over the coming days, PCCs. I'm happy to give you a breakdown in the Cho release this afternoon.
Do you have any details on a positive case at the Melbourne Remand Centre?
No, we understand there is a staff member who is a positive case at the Melbourne Remand Centre. Obviously, we're doing our usual protocols of testing extensively across both the staff cohorts and when necessary to people who are residing there. But at this point in time, we have no evidence of any onward transmission. And Rachel, let me just use this as an opportunity. We've seen over the last few weeks in particular a number of incursions into our healthcare settings, into aged care facilities, into the remand centres. We've also had, I think, a detention centre who also had cases coming from the community. And this is now part of the pattern we're seeing in Melbourne with significant community transmission. A number of workplaces are being touched by staff coming into those workplaces having brought the infection in from their community exposure. So far to date, with very few exceptions, our workplaces have maintained really strong COVID safe protocols. So we've seen fairly minimal amounts of onward transmission at workplaces. Of course, the exceptions are the ones we've talked about in the last few weeks. And again, I'd like to thank employers and workplaces for doing such a sterling job, such an important thing at this point in time to have those COVID safe plans in good shape. But please, be very, very vigilant. We cannot afford for the virus to go into some of our most sensitive workplaces, and every day we need to manage that risk.
And just on the factory and exposure side?
There is, I believe, there's one member of staff who has had access, who's worked. We're just trying to work through their infectious period at the moment.
And on prisons, do you know what rate of prisoners have actually been vaccinated? It's obviously a very vulnerable setting. And are you planning on doing a vaccination blitz in prison?
So there's been a significant amount of work, as you know, I think over a number of months now to ensure the vaccination of prisoners and also, of course, staff working in our prison sector. I don't have the numbers in my head, but we have a very widely advanced vaccination programme. Happy to brief on that in the coming days.
And I'm assuming, and I'm pretty sure that your focus right now with the Fitzroy School is to contain that outbreak. But do you have any idea where the index or how the index case may have acquired it and who the index case is? Was it a student or a teacher?
Yeah, not at this time. So, I mean, obviously, look, it's a significantly sized school. There's 189 primary close contacts across across the staff and the student body there. We'll be sure we get them all tested. I don't as yet have an acquisition for that particular cluster, but the school will remain closed until we've completed that initial phase of testing and we have a better understanding of what the exposures have been.
Does that mean those 189 are all just students and staff, or does that include their families as well?
At this point in time, my understanding is that's all students and staff.
Have the staff been COVID compliant at that school?
We haven't done the detailed investigation yet. There are some conversations underway with the school to understand the geography, as we do with any school, the geography and the layout of the school. Obviously, we've had, at the moment, schools are only open to children of essential workers. So we'll be working through with them to understand who's been in and out of the school, what their movers and contacts have been, and how strong their COVID-safe plans have been.
They've obviously been flouting CHO restrictions regarding closures in schools. Are you confident that the students and the teachers and the staff will actually abide by stay-at-home directions during their 2-week isolation?
Yeah, look, I think we'll treat this like we do with any other site, and we don't run our response based on media commentary. We have now a number of people, 31 people who've got the virus in the community, who obviously we're primarily concerned about their welfare and their safety. So that's the initial focus. We'll now want to see how far the virus has got out into that wider school community, and until such a time as we understand that, the school will remain closed.
Are there heightened concerns over exposure sites at childcare centres and other schools?
Related to this particular exposure or generally?
Yeah, and others.
Oh, look, I think we're always concerned about exposures at any school, at any childcare centre, for a number of reasons. One, of course, we've seen, as the Minister has said, this outbreak is an outbreak of the young and of many children and young people, and we continue to see a disproportionate number of younger people caught up in this particular set of outbreaks. Secondly, we're also, because childcare centres and schools at this point in time are providing an essential service to essential workers. That's why they're still open, and that's what we have significant concerns then if we're seeing the virus getting into those settings. One, because it does mean that those schools are closed and that those essential workers who are relying on the school to support their children can no longer do so. So that has wider knock-on implications. So, as we always would do, we're always more concerned about childcare and any other sensitive facilities, and our response will dictate that.
How does this change advice for term 4?
Sorry?
How does this change advice for term 4?
I'm not the Chief Health Officer. My focus is responding to the outbreaks and making sure we get them under control. Mark.
Have you considered how to handle outbreaks or exposures at GPs and other pharmacies that are obviously helping with the vaccine rollout?
Yeah.
A number of them have been quite vocal online today and in previous days about them being knocked out when they're trying to provide an essential community service. So how are we treating them? Is it going to be similar to the Royal Melbourne Hospital, where there were some considerations there?
Sure. Yeah, look, we've actually had good experience and good evidence over the last few weeks around how we manage those critical healthcare settings. We've had a number of exposures in some of our larger hospitals. All of those have been managed by appropriate furloughing of staff and appropriate COVID-safe behaviours, and it goes back to the theme clearly of this morning. The strength of those COVID-safe plans will dictate the impact of positive community members interacting in those environments. Again, most of our GPs and pharmacists will be very well experienced about running really strong COVID-safe plans. They've been serving their communities for the last 18 months, whilst we've had different levels of COVID circulating in the community. It'll be really important for any GP clinic, any pharmacy clinic, as it is for the state clinics, to have really effective protocols in place around social distancing, around assessing people who may be symptomatic, and about managing those kind of outbreaks when you do get them. But I think to date, the Victorian experience has been pretty strong. I think our clinicians know how to manage these kind of settings, and of course we'll continue to advise them if they need more support.
But a number have been knocked out for 14 days because they're exposure sites. So I'm saying if they've got all those COVID-safe settings in place, would there be any leniency for them, for those, particularly staff, who are in the full PPE, to be allowed to come back?
Yeah, look, and that'll come down, Mark, to the strength of their furloughing plans and the strength of their COVID-safe plans. So if you look at the way we run this within the state hospital sector, a lot of time and energy is put into effective workforce management, minimising that interacting of different staff cohorts, reducing it down to as much as possible, and also the really strong protocols around PPE. Hence my call out this morning around tea rooms. You can destroy all that really good work about staff working in complex PPE and complex rostering arrangements to minimise contact. If they're all going to sit together and have lunch together every day, then that is a complete opening up of that kind of system. So it needs really careful attention for the entire working day to make sure you keep those staff separate, and then we can minimise the number of people that get caught out when there's a positive case that comes through. And we all now have to recognise that with 3,500 positive cases in the community, every single workplace, every single shop that's still open will at some point run the risk of being exposed to COVID. The numbers will dictate that. So you need to have those plans really tightly under control.
Just on contact tracing, over the past week and a half, our number of active cases has roughly tripled.
Yep.
But the number of exposure sites listed has remained pretty steady at around 1,000. I think it's nearly 1,100 today. Is that because we're only now listing the sort of exposure sites that are of greatest concern, or is that because we're slipping behind with contact tracing, or a bit of both?
Sure. Well, first, we're not slipping behind with contact tracing. Let me start with that. So, of the 473 cases that we identified up to midnight last night, 446 were spoken to yesterday directly by one of our contact tracers, getting their key initial information. The other 27 who dropped very late last night, and we tend not to phone people at midnight, were contacted this morning to get the same information from them. So we are right on top of our cases, and we're right on top of our primary close contacts to ensure we can protect them and isolate them from the rest of the community. Clearly, what we are seeing is a significant number of those new cases, as we've seen day after day after day, are household members of existing cases. So these are people who, on the whole, do not have new exposure sites. They are clearly operating within fairly tight family isolation bubbles. And as we're under lockdown, we would continue to expect to see a slower rate of new exposure sites being identified, as frankly most of us aren't going out very much, and unfortunately, nor should we be at this point in time. We will, of course, as we continue to go forward, we are absolutely putting more and more focus on those high-risk exposure sites. There are absolutely cases where we see lower risk, what we would have regarded and what we would still regard in a regional setting as a tier 2 exposure site that we would put a lot of energy into. In our northern and in our western suburbs, we probably won't go to the same degree of detail as we would have done previously. But that's a matter of nuance and detail. Overall, this is around, as the numbers grow, increasingly we're seeing people out of those same households coming forward, and that's what's driving the growth at this point in time.
Just to clarify, you said that it was a staff member at the remand centre that's tested positive. The remand centre's put out a statement saying it's a prisoner who was asymptomatic. Is there another?
Okay. I need to check and come back to you on that one in that case.
How many GP clinics in the north have been made tier 1 sites, and is that a problem for the community there?
I don't know. B, I can go and check. Is it a problem for the community? Look, clearly it is. I mean, as I said, any facility that's open at this point in time is there because it's providing an essential service. So whether it's a GP clinic, whether it's a supermarket, whether it's any of those facilities that are still there because everything else that isn't essential has already been locked down. When we get to a position when a workplace has to close because it's been an exposure site, of course that reduces their service to the wider community. Goes back to my earlier point. That's why you need to ensure you've got really strong COVID-safe plans in place. The vast majority of times, we can, if you have an exposure at a physical place within 24, 36, 48 hours, we can get it reopened if you've got strong COVID-safe protocols in place.
Is it a concern that people are presenting to GPs with COVID symptoms?
Yeah, absolutely. And again, we see the same thing in our emergency rooms, unfortunately, which is that there is again, as we see more cases of COVID in our community, we've always and we will continue to encourage people, please come forward quickly at the earliest onset of symptoms, or if you've been to an exposure site, or if you're living with somebody who you know has got COVID. They're all the things we really urge people to do, and we continue to urge people to do. We are regrettably still seeing people coming forward with very advanced symptoms to emergency rooms, into their GPs. If you've got symptoms, please don't do that. If you've got symptoms, get tested so we know whether you've got COVID or not, and then we and the wider health system can support you appropriately.
Is that just a problem just in the north or across the city?
No, look, generically speaking, it's a pattern that we see across Victoria. We continue to see people presenting late with symptoms. Some of our regional cases of recent days, again, have been people who've presented later than we would like when they've been symptomatic for a while. Clearly, where you've got the more cases, you're going to see that more often. So, absolutely, if you're running a shop in the northern suburbs, or if you're running a GP's practice in the northern suburb, you're more than likely to see people coming forward with COVID, just given the level of prevalence we currently see in the community. But it's the same thing in the southeast. We've got 23 odd cases today in our southeastern suburbs. That's a significant level of COVID, given the history we've had over the last year.
Can you please provide us
Mitch.
Do you think there's any merit in turning the MCG into a mass vaccination site, given low vaccination numbers within the City of Melbourne?
Look, I think operationally, our focus is entirely about making sure we get all the vaccine we receive into the arms of people. We're particularly focusing right now on our northern and western suburbs and ensuring we start to really focus the additional vaccine capacity we're going to get into those areas. So I certainly wouldn't want to displace capacity from the north and west into the central suburbs. If I look at the CBD area, we've got the RAB round the corner. It's not far away from the MCG. We've got Jeff Shed, again, not really that far away from the MCG. So, look, if there's more vaccine around and another workforce around, sure. But I wouldn't displace what we're currently doing from places that I think arguably are closer to where people need to get vaccine.
Do you think the novelty of the MCG, though, might encourage some people that are sitting on the sidelines to get vaccinated?
Oh, look, it doesn't feel like the biggest priority at this point in time, Mitch. I think is what I would say. There's any number of fun places to go and to get vaccination done, but at the moment this isn't about fun. This is about let's get the vaccine program delivered, and the messages we're getting, and very strongly from the community, is bring it to us and get it as close to us as possible, and that's what we're doing, and that's why the numbers are going higher than ever before.
Mr. Foley, sorry.
Yes.
Mr. Ryan, if that's all right, do you have any more information? Sorry. Do you have any more information about this CSL exposure?
No, nothing more. No, I can go and look it up and give you a briefing later on.
Is that impacting production?
No.
In no way.
No, not to my knowledge.
And just before we go to on the vaccine rollout, do you have any more details on those pop-up clinics and how they're operating in the north?
Yeah, so we've got, I think we announced yesterday, a number of additional pop-up clinics that we've got operating across our LGA our priority local government areas at this point in time. There will be a number that will start to land this week. We will announce as we go along. There'll be a number that start to land this week, and it's part of a wider rollout of two things. One is some priority locations that we've been working on for a number of weeks. We did the Newport Mosque until recently. We've been running at a number of other locations until recently. Those pop-ups will continue to run in the community, and of course we're starting to land our school hubs as well, and they'll be a feature of the weeks ahead.
And what about supply? Do you have any details on the supply, where those appointments are the most?
In terms of?
In terms of those pop-up hubs.
Sorry,
will there be some areas prioritised more than others?
Oh yeah, look, I think the school hubs we're prioritising around where we think there's particular need to put additional vaccination opportunities, where there are parts of our city or parts of the state where there's relative underrepresentation, where we have less coverage of GP clinics and pharmacists and existing state clinics. So we're trying to fit in the map. So where the people are who need to get vaccinated and where there are fewer current access points, then the schools are yet another opportunity for us to put vaccines right into the heart of our communities. So we'll continue to go and do that. From time to time, we run additional pop-ups at certain locations, generally where we're seeing either outbreaks that we've got concerns about, and we see another opportunity to work with local leaders to bring vaccines to them.
And those vaccine appointments available today, the Pfizer and the AstraZeneca, where are they?
Well, they're across our state clinics. So we've got, as I said, we've got 12,000 AstraZeneca appointments available over the next 7 days. We've got 55 plus state clinics. If you go online, you'll find out where those AstraZeneca appointments are. And similarly with the 2,200 Pfizer appointments available over the next 7 days, those are across our state clinics. As the Treasurer said, we have reserved appointments available for construction workers, an additional 20,000 on top of that over the next few weeks. So there's additional appointments available for certain cohorts, but anybody now can log on to our online system or call our call centre and find out where those 14,000 vaccine appointments are that are available and that are free now for the next 7 days.
What's the process for 12 to 15-year-olds? Can they go online, or do they have to call?
So they can either go online, they can go on with their parent, or they can go on, or they can call any which way. So we're also now doing a group booking functionality within our vaccine appointment system. So parents can book in with their children to go and get the family done. And I'd urge you to go and do that.
Just double checking, there's nothing extra for that cohort. They're just now in with the rest.
No,
so
at this point in time, that's just we've opened up. Children aged over 12 to 15-year-olds who were not eligible before today are now able to access those same general appointments as everybody else.
Can children under 18 go of their own accord, or do they have to have parental permission?
That's a good question, Rachel. I think 16, 17-year-olds need to have an approval from their parents, but I can check with you on that one.
And can we just get Minister Foley on priority vaccinations? There's been calls over the last couple of months to get childcare workers and teachers, for example, or even supermarket workers for priority access to vaccine. They work indoors, and arguably the education of children has been interrupted and disrupted so badly. Is there any particular reason why they weren't prioritised first as opposed to the construction sector?
So teachers in particular groups have been prioritised for some time. Teachers in special schools, teachers who have kids with high needs in their class groups. and of course teachers and associated groups associated with the current VCE student blitz. And from advice that we've received from education more broadly, teachers have been very well represented in that wider community uptake of the vaccine figures via age group that Jerome took us through. So in that regard, teachers have been doing a fantastic job in coming forward and getting vaccinated. What we need to do is to make sure that we go that next step and on a risk basis, stepped across available supply. The data tells us that the priority group needs to be our VCE students, the North and the West, and the construction sector. So based on those risks, that's where the emphasis has gone, and I want to keep encouraging teachers to come forward in the very strong numbers that they have.
And can you walk us through some of those risks, particularly in the construction sector? What are the vaccination rates there like? And obviously they're working outdoors as well, so does that reduce the risk a little?
Yeah, so they're not all working outdoors. Some of the sites have been fit-out sites of concern, and that's where the tea room issue that Jerome touched on comes into place. But particularly on the smaller sites, a lot of it is outdoors. In regards to the 3,500 cases we've got now, approximately about 13% of our current active cases are directly able to be linked back to construction sites, big, small and in between. And in that regard, that's a significant proportion. The fact, as the Treasurer pointed out, is that they're also disproportionately highly mobile. They're disproportionately from the North and the West. And as a result of their permitted worker status being able to cross the regional metro border, they're also overrepresented in the small number of cases in regional Victoria. So on all of those risk metrics, the industry knows and has got the message loud and clear that their performance needs to improve. Whilst, of course, the majority are doing the right thing, it doesn't take much for this highly infectious Delta variant to get from a highly mobile, younger, under-vaccinated workforce into our suburbs, into the families and communities of those suburbs, and as we've seen, into the regions. Hence the compliance measures, hence the targeted vaccine program, because it's based on public health risk.
And do you know what the vaccination rates among construction workers are? And if they continue to flout the restrictions, what penalties potentially are they facing?
So as the Treasurer indicated, it's pretty clear cut. Things either have to improve or the status of the sector as permitted workers is at risk, and that means the sector faces closure.
Vaccination rates among the industry?
I don't have them to hand. If they're available, we'll get them to you.
And
but
do you have
in
any...
terms of the wider workforce, because they are younger, we would imagine they would reflect that same demographic of being underrepresented as per the age-based rollout of the program since it commenced in March. And just to make the point again, back in March, Victorian government, indeed all state governments, signed up to the national rollout, which had the state delivering about 27% of vaccines over the course of the Commonwealth's rollout. We're sitting around 50%, and we're happy to do that. In fact, we push to do that, and we will push continually to focus on those areas of greatest concern.
Minister,
our VCE kids, our construction industry, our north and western suburbs, and whatever other measures need to be taken.
Apologies.
Just on that, if we're prepared to prioritise construction workers, why aren't we also prioritising the whole education sector, given that we're repeatedly told this is the outbreak of young people?
Well, I just indicated that VCE is part of our priority.
But wider than that, why is everyone in the education sector not being given priority, given that a key focus of the government, it seems, is to get kids back into classrooms?
So I also indicated that substantial parts of the education community have been in the priority groups for some time and have, as a result of a whole range of factors, been able to be vaccinated at higher levels. In regards to the priority of what is available, when it comes to vaccines, we prioritise the areas of greatest risk at that time.
Speaking of what was available, when did you first learn about these additional 417,000 doses coming to Victoria?
Let me take you through the timetable. So I speak regularly with my federal counterpart, and I have a good working relationship with Minister Hunt. You would expect that in a global pandemic. Our officials, in terms of vaccine supply, talk all the time. There's a multitude of factors to manage. The Commonwealth procure it and provide it to the GPs and the primary healthcare network, and they provide it to the state clinics. That's the deal. On Friday, I rang the federal minister and pointed to the need for the priority for the north, the west, and other emerging sectors, particularly in the southeast. I wrote to the federal minister on Saturday. The Prime Minister made his announcement on Sunday morning. The federal minister rang me on Sunday afternoon, and he wrote to me this morning confirming it. So that's the time.
But in your discussions on Friday, it was never mentioned, because he seems to be trying to...
I asked him for extra vaccines as a priority, particularly to make up for the reallocation over and above what was on the table that had been established for New South Wales. Minister Hunt had said that the officials had had discussions and that an initial 100,000 was on the table. My request was that that wasn't enough and that we needed more. We reflected that in our correspondence on the Saturday, and I was pleased to see more vaccines confirmed on the Sunday.
Melbourne Grammar is starting its own school-based vaccination program this week. Can you explain how they've got their supply? Is it through GPs?
No, I can't. You'd have to ask Melbourne Grammar, but I know a whole range of schools have made arrangements with private practice for similar arrangements. In regards to Melbourne Grammar in particular, I can assure you it hasn't come from a state source. Realising that the majority of vaccines, and an increasing majority now, are being provided into Victoria, into either GPs and starting next week into community pharmacies.
And our outbreak is currently accelerating faster than New South Wales was at this time of their outbreak. How concerning is that, and will that jeopardise getting kids back into the classroom?
Oh, look, I'm very concerned. Just on that measure, that's if you date it from the 4th of August. So there was that one day of zero. If you go back to June, you get a different measure. Nonetheless, whatever it is, it's unacceptably high, and it is a major concern for us. We want to get all those kids back to face-to-face learning as soon as we can. We want to deliver the GAT as soon as we can to give that foundation for the VCE and Year 11 students, and we want to get the VCE exams off and running. We're already carefully opened in the regions a number of year levels at the senior and most junior foundation year level, and we want to build on that. But we can only do that when it's safe to do so. As we've seen in Fitzroy North, schools can be areas of really high transmission, and we've got to be mindful of that.
Just back on your correspondence with Greg Hunt. Sorry. When you spoke to him about maximising our Moderna allocation, what did you mean in that regard? It had nothing to do with these excess doses, you're saying, or extra doses?
So Moderna is being allocated not to the states clinics or nor to the GPs. It's being allocated to the pharmacies. So I went through a whole range of issues. Firstly, the disproportionate sling that went to New South Wales and the need to square that up as soon as we possibly can, and to get that into the north and the west and the southeast through state-run clinics. That we needed to bring forward more GP clinics across the board, but particularly as points of contact in the north and the west and the southeast. And in regards to Moderna, again, make sure that the community pharmacies were going to be particularly targeted to the north and the west and the southeast. And I also raised, could we have some confirmation of certainty of supply coming into October? Because whilst we have the General Fruin's Horizon document, we haven't yet had, as we normally have about this time of the month, a written confirmation as to what's coming in the next month. And what else did I raise? A couple of other bits and pieces, but they were the main points. And I had a very constructive conversation with Mr Hunt. I know our officials had lots of constructive conversations on the Saturday. I then wrote to Mr Hunt on the Saturday afternoon, and he wrote back yesterday afternoon.
The Premier seemed to
this
indicate
morning.
yesterday. Sorry, the Premier seemed to indicate yesterday that he was unaware of this allocation being sent to Victoria. Were you sharing those conversations you'd had with the Federal Health Minister, with the Premier, to loop him in?
They were my requests. So there was no confirmation at any time that those vaccines were coming until such time as the Prime Minister made his announcement. That's fantastic. We welcome more vaccines. So I understand the fascination that you all have with it, but it's pretty clear. I rang, I asked for more in the priority areas that we need them. Our officials did the work. I wrote and asked. The Prime Minister then made the public announcement, which was the first confirmation that the vaccines were being provided. Mr Hunt then confirmed that later on Sunday, and the written confirmation of that showed up this morning.
Do you think the state should be given a heads up when things like that are coming?
It'd be nice, but we've come to expect that. All states have come to expect that over the course of the Commonwealth's rollout. It's a dynamic field.
Given the Premier didn't approach the Prime Minister directly last week about that make good for the extra doses that New South Wales got, was this basically the Commonwealth playing the game he played back at him?
No, I don't think that's fair. Like our professional relationship at both an officer and Minister for Health to Minister for Health level is all about getting vaccines from the people who procure them, the Commonwealth, to the people who deliver them, the states and the GPs and the pharmacies, as quickly as we possibly can. The position's pretty straightforward. Lieutenant General Fruin had essentially confirmed last week that some arrangements needed to be squared off, and I'm pleased that this seems to be a contribution to that.
Minister, what day?
Sorry, just on that same question, if that's all right. The Federal Health Minister said this morning on radio that Daniel Andrews was seeking conflict, he suggested.
What was he saying?
He suggested that it's up to the Premier whether he wants to seek conflict in regards to this extra allocation of vaccines.
No one's
Do you
seeking
think that's a helpful comment?
No one's seeking conflict. You indicate that that's Minister Hunt's comments. I'd want to see the context in which they were made. We've got a good working relationship at officials level. What we want to make sure is that transparency is there in what is provided to who and how. And that's what I requested in my letter, and Minister Hunt wrote back this morning setting out his position on that.
Minister, what comments to make on the Fitzroy Community School principal who obviously, outright defied Chief Health Officer orders and encouraged parents to send their kids to school?
Look, our first priority is the well-being of those kids and their family and the staff. This school has some history when it comes to sailing pretty close to Chief Health Officer orders. Our compliance people, after the priority of responding to the outbreak is dealt with, will investigate the matter and, based on whatever outcomes they come up with, take appropriate action. Our key priority is the well-being of those kids, the staff and their families.
So do they face, I don't know what the business fine at the moment is, $10,000 or $20,000?
It's far too early to say. Our focus is on the well-being of those kids, their families and the staff. In terms of compliance activities, that will take its normal course.
And do you think he should be deregistered?
it's not for me to say.
There were reports overnight that emails were being sent by the principal to parents quite repeatedly over the course of the last lockdown. Do you think that's appropriate, and does that warrant a fine?
I think everyone should follow the Chief Health Officer's orders, and that where you don't, there's consequences.
On the pop-up,
Not the least being, kids get sick, families get sick.
on the pop-up vaccination clinics, just before you go, do you have the finer details of how they'll operate in the north, and are you confident they'll be effective?
Of
The pop-up vaccination
Oh,
clinics
yeah,
in
yeah.
the north.
Well, they've already been operating in the north, the west, and a range of other areas, and they'll continue to be effective. You raised a question earlier about where. I'll just refer you to the Premier's media release yesterday of the 100 postcodes at that really granular local level. I refer you to some of the comments that were made yesterday by some of the community, the culturally and linguistically diverse organisations in the north and west who have already got locations hammered in. It's been dealt with already. It takes it to a new level, and it's all about taking the vaccines to the community that needs it the most.
We've got our 70% first dose target. We're getting tantalisingly close to reaching it. I think we're on a trajectory to getting there on Friday. Will there be any announcements, perhaps Wednesday, Thursday, even tomorrow, about what freedoms we might be able to look forward to?
We've indicated that when we get there, the initial indication was the 23rd of September, we'll have something to say. I'd encourage every Victorian to get vaccinated as quickly as they can to get us there as soon as possible. What gets announced when we hit certain targets, we'll have more to say about in the not too distant future.
Minister, just on what I asked Jerome before about the MCG pop-up vaccination site, yesterday the state government expressed interest in it, the feds expressed interest, but both appeared to, I guess, shift responsibility. How likely do you think that that's going to happen? Is it something that you support?
Oh, look, I'll just reinforce Jerome's comments. Vaccine supply is a matter for the Commonwealth. We have clear priorities in allocating every single vaccine that we get through the state-run clinics. We're running at over 98, 99% efficiency. You get it to us, we get it out. And we want to make sure that those vaccines are delivered to the people in the communities where those people are and where the need is. At the moment, our priorities are the north, the west, the VCE group and the construction group, because that's the areas of greatest need. If the Commonwealth can provide more vaccines for whether it's the MCG or Luna Park or anywhere else that could be a fun thing to vaccine around, then that's great. And we'd be strongly supportive of helping get Victorians to participate in that. But our priority is take the vaccines to where people are in the areas of greatest need. The north, the west, the VCE and school communities and the construction industry. And if the Commonwealth want to provide us more vaccines into Victoria to do more work, we will happily take that.
And the opposition are calling for family bubbles to be allowed for the AFL Grand Final. Family bubbles. So groups of families to come together for the AFL Grand Final. How likely do you think that is? Is that something that you'd commit to looking into?
Look, we'll be taking the Chief Health Officer's advice, not the opposition's advice when it comes to public health matters. The intriguing number of positions they've had on public health matters is an issue for them. We'll follow the Chief Health Officer's advice.
Do you think it's a possibility, though, in 2 weeks that some families could gather for the AFL Grand Final?
Let's see what the Chief Health Officer's advice is.
Do we know if the Ballarat disability worker was vaccinated? Sorry.
I believe so.
Fully vaccinated or just one
I'm
dose?
not sure, but certainly at least one.
Thanks.
Just on the construction crackdown, do you have an idea?
You might want to ask the Treasurer.
Sure.
But what's the question first? We'll see.
Do you have an idea of how many sites are breaching COVID rules? Is this a serious problem? How many do you think?
Well, I don't have a indication of exactly how many sites. I think what we can tell you is something close to 6,000 inspections have occurred. We are very much aware that the government's been going through its authorised officers and its work safe inspectors a process of, can I describe it as management of the issues, education, but they formed the view, the government's formed the view that that is at an end and strict enforcement and zero tolerance will now be the case. So in terms of issues around compliance, I think the industry is very much conscious of this. They've indicated their willingness to participate in the process. Fines, of course, from the 1st of July increased to between $1,817 to $10,904 for COVID breaches, serious and blatant breaches by that result in courts, and fines are up to $109,040. That's for body corporates, and the powers include prohibition notices, penalty infringement notices, that's fines, and improvement notices. That'll also be options for both WorkSafe and AO. So there's a considerable scope of capacity, which could include shutting down those operations through those prohibition notices.
This sounds like a silly question, but what are you actually looking for when you go to these construction sites? People are wearing masks constantly. What kind of things do they have to abide by?
Well, that's exactly it. Each construction site has a COVID-safe plan that they're required to have put in place. They know what their obligations are, and they go to things such as appropriate mask wearing, appropriate social distancing, and applying the requirements of a safe workplace in a COVID environment. Jerome's taken us through the issues associated with tea rooms being an increasing area of topical and substantive concern. And of course, minimum numbers in enclosed areas is a key part of any COVID-safe strategy.
Will these inspectors to workplaces be fully vaccinated? And are you concerned that they could carry a risk of transmitting it from site to site?
Well, of course, we're in the process at the moment of seeking to ensure that as many people in this industry are fully vaccinated, and we're moving through that process as quickly as we can. Of course, WorkSafe officers and anybody else visiting building sites will be in exactly the same situation. We will prioritise and facilitate that they get the necessary vaccinations, whether it be an architect who wanders onto one site or multiple sites, whether it's a worker whose job is particularly at one exclusive site. We will do everything we can now to prioritise their access to vaccines.
Just
on that, if that's all right. The health advice around mask wearing is a little bit vague when you put it in the context of a construction workplace. The rule is you have to wear masks in a workplace, but if it stops you from doing your job or you're doing strenuous exercise, you're not having to wear them. What is the rule with masks around workplaces? Should they be worn all the time on a construction site? Under what circumstances can they have them around their chin?
Well, look, I'll leave it to the Chief Health Officer to explain his orders, but I'll make the point that people shouldn't have a lend of the community by trying to find ways to cleverly avoid their obligations. They've been given a privileged position in terms of a capacity to continue to operate when so many other Victorians do not get that same opportunity. Of course, in strenuous work environments, that is a rule for common sense, but quite frankly, it should be an exception rather than a rule, in my opinion, because if you take your obligations seriously, if you're concerned about your fellow workers, if you're concerned about the prospect that you might actually take the virus home with you, into your family and across your community, then you're not looking to find loopholes, you're looking to do the right thing.
Can I just quickly ask the Health Minister, just on New South Wales, they're saying that their health system is pretty much stretched at the moment. They're going to be asking other states for a bit of help. Firstly, have you been asked? And secondly, is Victoria in any kind of position to provide any help for New South Wales?
No, we haven't been asked. We would always consider any request on its merits. pointing out that along the Murray, we certainly do look after, particularly on the other side of the border bubble, substantial numbers of people from New South Wales. But our clear priority at the moment, with 3,500 active cases, is the Victorian outbreak, and making sure that our hard-working healthcare frontline heroes are supported every step of the way. Having said that, if their request is made, we'll of course consider on its merit, and we look forward to that.
And some restrictions are easing in New South Wales today,
beg pardon?
some restrictions are easing in New South Wales today, like groups of 5 who are vaccinated can have a picnic. What's your response to that?
I think any public health measure in New South Wales is a matter for the New South Wales public health officials. Thanks.
Oh, thank you so much. Thanks, Jerome.
G'day, hey. How are you? Welcome to the show.
Oh my goodness.
Yeah. You haven't been up here before.
No.
There you go, now you have.
That's right.
You're all over it.
Thank you.
Easy.